So it looks like we have less than 60 seconds to go. As more are entering the room, I want to say hello and welcome. You have found your way to exploring a prevention mindset. We're going to get underway in just a moment. My name is Jessica Matley. I'm a training coordinator with CalTrin. So we are going to be underway here. I think we will get started right about now, but I want to see these responses. Being able to help parents realize they can advocate for themselves and their children. I love being able to work closely with the community and help people. Awesome. So I want to say thank you to everybody that put a response in. We're going to get started because all of this gets edited out in the post. But thank you. And I feel like that heart that you have, that passion for families, that passion for your community, for organizations, for other professionals, that's our springboard for this conversation. So as we explore this mindset, we talk about these different concepts and frameworks. It's all with the intent of exactly what we're talking about here. Okay, so I'm going to officially start. And thank you so much for your beautiful comments in the chat. All right, so hello and welcome to Exploring a Prevention Mindset. This is a webinar in the Reimagining Prevention series. My name is Jessica Matley. I'm a training coordinator with the California Training Institute, but you might know us as CalTrin, and I hope you do. We're funded by the California Department of Social Services, Office of Child Abuse Prevention, and in a few short moments, I'll share a few more details about our services. We actually have a lot of content to cover in the next 90 minutes, so I am going to get started. All right, so here's a few notes and reminders this morning. Is this session being recorded? Yes, it is. And a replay of this session, as well as all of the previous webinars in this series, can be found on the CalTrin or Strategies TA websites. To make it easy, we'll be dropping a link on where you can find that reimagining page on the CalTrin website. Next, do you have any note-taking slides, Jess? Is there a presentation available? Absolutely. What you'll see in the chat right now, thank you, Dana, one of my counterparts, you can see the note-taking slides. So if you click on that, you'll be able to access a PDF document with all of the slides on there to make it nice and easy for you. We'll probably drop it one more time as people enter the room. A follow-up email is sent to all registered participants within the next 3 days of this webinar with links, resources, and so much more. And then you'll want to take a moment at the end of the training. We will make it very quick on you. The survey does not take more than 2, maybe 3 minutes. At the end of the survey, we'll provide you with a certificate, but really the intent of this survey is to be a dialogue. It's a dialogue between your presenter and the audience to ensure that the objectives are met, but most importantly, questions you might have. And I'll tell you why in a moment, because this is not the only time we will be presenting on this topic. All right, so I want to direct your attention to some of the interactive features you might see in this webinar. I know you're a Zoom expert, but I want to make the distinction between how we're going to use the chat and the QA feature today in this particular training. If you have a question throughout the webinar, you are encouraged to use that Q&A feature. It's going to be our parking lot. We'll collect questions in there so they don't get lost in the chat, because I will be asking you to use the chat quite a bit. And we'll be able to extract all the questions to be addressed today or in the future if it's not going to be something that we're talking about today. And so I also have some counterparts on the line with me today, so they might be answering questions for you in the background as well. Just please make sure to use that Q&A function. We'll also be using that chat box quite a bit. So like I said, if you are asking a question, Q&A feature. If it's a comment, chat box. Please make sure that you're responding to everyone unless your comment is only for me. All right. So before we dive into today's topic, let's talk a little bit about this Reimagining Prevention series as a whole, the overarching who, what, when, where of what's been going on over these last couple months. So during our very first webinar, way back in February, Hillary Conrad, the Bureau Chief of OCAP, set the tone of our series with the following statements. She opened by saying, "Imagine if we could mitigate trauma and provide services to families without any system involvement. Imagine if children could remain in their homes and still be provided adequate supports and resources to thrive. And imagine if coordinated approaches were not only focused on children in the system, but those prior to the system." So it's with those statements, that vision, that's been shared throughout the series so far. It's really to create an integrated statewide system to reach families sooner, to build strong local prevention networks, to strengthen not only families but communities, and prevent child maltreatment and entry into child and family serving systems. How do we do that? Well, it's by building capacity of community partners, by joining with the others around a common goal of child and family well-being, and by starting to look at the larger landscape of services being offered across private and public agencies. So with this vision in mind, the Reimagining Prevention series was born a couple months ago. The goal of the series, which is a collection of webinars and different events, some of them are meetings, some are webinars, is really to bring all the players of prevention work at different levels of prevention to the table to learn about key foundational principles of prevention and to start reimagining the way that we're committing to, coordinating with, and investing in prevention work. Another goal of the series is for a diverse audience to come together to learn about prevention principles such as utilizing an equity lens, engaging with community when developing, planning, and implementing prevention work. The thoughtfully curated topics in this series provide information and ways for agencies to move upstream towards primary prevention to support and strengthen families. The ultimate goal is for all of us to work together to break down silos and to develop a comprehensive continuum of preventative services. I had to say it slowly. I'll try again. To develop a comprehensive continuum of prevention services that include primary, secondary, and tertiary strategies and interventions grounded in fairness and centered in equity. So for the first time, I thought I'd just give you a little reminder. For the first time, federal legislation has provided state agencies the opportunity to leverage Title IV-E funds, to shift to an upstream approach, to serve children and families, and to start thinking differently about when and how we engage with families and the quality of services we're delivering. So what does that look like at a state level? We're working hard. They're working hard on planning for implementation of this Family First Prevention Services Act Part 1. There is more information about it. I want to just distinguish what our training will and won't be about. We are focusing more on the change management aspect. So what we won't be talking about here today are funding streams. We won't be talking about the comprehensive prevention plan. We won't be talking about those in-depth details. We're really focusing on the change management aspect, specifically exploring a prevention mindset. So the good news is if you do have questions about those other topics, don't you worry. I have information at the end of this webinar that will be helpful to you there. All right. So let's talk about some of the partners and some of the players throughout the series that you might have met so far. So the California Department of Social Services, CDSS, California Department of Health Care Services, Strategies TA, and CalTrin have been meeting regularly to discuss what are the webinars going to be? What is the plan? What is the creation of this collection of topics and webinars to provide you with the best information in this Reimagining Prevention series? As a reminder, CDSS serves, aids, and protects needy and vulnerable children and adults. DHCS provides access to affordable, integrated, high-quality healthcare. Strategies TA provides technical assistance focused on building statewide long-term solutions. And CalTrin, or the California Training Institute, provides free professional development and extended learning opportunities to professionals, primarily staff for family resource centers, CAPCs, and other child and family serving organizations. So now that you've learned a little bit about us and a little bit about the series, this is where I want to learn just a little bit about you and who is on the call today. So I have a few questions for you. Oh, I take it back. I will have a few questions for you in a second. I just wanted to remind you of this graphic. This is the roadmap for comprehensive planning and implementation. And I wanted to, again, reiterate that we are going to be focused way on the left side of this page. We're talking specifically about guidance and information in the area of change management. That's really what we're focusing on today. There's a lot of great other things to talk about when it comes to this slide. They just won't be addressed in this webinar, but I will tell you where you can find that information at the end. On to my questions. So I saw that we had some registrations all around the state today. So my first question for you is, where are you? So if you could see on the screen, we have a map of our great state with some color coordinated areas. I'm just curious to know, where are you joining us from? I see some answers coming in. Thank you. Wonderful. It looks like we have over 50% of you have responded. 60%. Well, look at you. We are interactive this morning. I appreciate that. Wonderful. Okay, I'll give you a few more seconds to get your answers in. Maybe check out in the map. Where am I? All right. Thank you. I'm going to end this poll so I can share. This is exciting. So it looks like we have people in every region, which is very exciting. I hope you can see that there. I myself am located in Southern California. Nice to meet you. But as a CalTrin training coordinator, my goal is to know someone in every county of our state. So it's exciting to see that many different regions are represented here. My next question for you this morning is, what is your role? So I know that we have so many different fields represented today, organizations represented today, but I'm curious to know, where are you coming from? So I am going to start that poll here in just a moment. Oh, welcome. Okay, so my question is, what is your role? You'll see that there's a couple different options. It's quite wordy. We gave a lot of different options here. So I'll give it a second as you read through them. Great. All right, they're starting to roll in now. Wonderful. If there is a, let's say, C, none of the above, then you could put it into your, into the chat, please. Supervising probation officer. Wonderful. Welcome. Great. Outreach specialist. Great. Okay. So it looks like we have a great diverse crowd here today, which I'm very excited about. I'm going to end this poll and I'm going to share it so that you could see it as well. Look at that. This is when it gets really exciting, because a lot of this conversation about reimagining prevention and exploring prevention mindset is about bringing many different players, many different organizations, roles to the table. And that's really what we've done here today. So it's really exciting to see that we are able to model that. All right. I love seeing where everyone is from in the chat. Thank you so much. All right. So now as we move into this topic of the day, I again, just before we start, want to clarify again our objectives. So what exactly are we going to be talking about, and what are we not going to be talking about? So what we'll be talking about today, our 4 objectives, are to review how your important work fits into the CDSS prevention framework. That would be primary, secondary, tertiary. Where do you fit? What does that look like? We're going to discuss the benefits of a prevention mindset. We'll even talk a little bit about what that means. What does a prevention mindset mean? We'll explore how to leverage the protective factors and social determinants of health to develop a prevention mindset. And then we're going to explore tools and resources for organizations moving towards a prevention mindset. I actually pulled an example from a previous webinar from someone that gave a great perspective from their seat, what it looks like to be maybe traditionally in one area, maybe in tertiary services, but to be thinking upstream what that could look like. So I'm excited to share that with you today. What I will not be covering today are the details of the comprehensive prevention planning. I won't be talking about funding today, but I will let you know where you can submit those types of questions and the types of webinars that are coming up that might answer those questions for you. Great. One important thing to note is I said sometimes your questions will be answered now or in the future. This webinar is under the umbrella of Reimagining Prevention, right? The Reimagining Prevention series. But this particular training is the first of 3 change management specific webinars that will be offered. So today we're laying that foundation with exploring a prevention mindset, where we're really going to focus, on what is it? Where are you in the process? How are you using primary prevention, even if you don't know it yet? So we're going to point those things out. But next, in a few weeks, we'll be talking about leading through change. This is where we will review the process of change within an organization. So we'll be talking about the J curve, the team development model, all of those fun logistics, operational details. And then the last topic that we're going to cover is cultivating commitment. And that'll be on May 17th. We'll focus on exploring a framework for team commitment towards a primary prevention mindset. And as you can see, Dana, our amazing CalTrin training coordinator, she's my counterpart, has also dropped some information on where you can register for those remaining webinars in the chat. So thank you so much for that, Dana. Okay, so to get started, I've seen this tagline as part of the Reimagining series on all of the webinars. So it says Reimagining Prevention, and right below it, moving upstream to support and promote child and family well-being. So that tagline that's been used throughout, I want to level set our conversation and start there. Let's talk about that moving upstream with a little story that illustrates the upstream approach. You've probably seen a version of it, but I want to cover just in case because we're going to set some foundation today. So you might have seen an image similar to this when we talk about upstream, downstream. What does that look like? What is the approach? This particular story that I'm going to share is from a book. The book is called Prevention is Primary: Strategies for Community Well-Being. And the story goes a little something like this. While walking up the banks of a river, a passerby notices that someone is in the water. They need help. They're drowning. So they pull the person to shore. After pulling them to shore, the rescuer notices another person in the water. They also need help. Before long, this person notices that the river is filled with people in need of some assistance. And they're trying to pull them out, but that's not enough. So more people join and are required to assist in that rescue process. Unfortunately, some people can't be saved. Other victims fall back into the water even after they've been saved and pulled out. At this time, one of the rescuers starts to walk upstream. And someone asks them, "Where are you going?" The rescuer replies, the one that's walking upstream replies, "I'm going upstream to see why so many people keep falling in the river in the first place." And as it turns out, at the top of the river, there's a bridge, and that bridge led across the river, but there needed to be some repairs. People were falling through. That bridge had collapsed. People were falling into the water and into the river. The upstream rescuer realizes that repairs to that bridge upstream will prevent other people from ever falling in the river and being in that predicament in the first place, thus ensuring conditions where people aren't falling into the river needing to be rescued. The process of moving upstream requires a focus on strengthened families, community, and cross-sector collaboration. So for this reason, it requires that primary prevention upstream approach. We're going to see this graphic more than once, but I wanted to share this story. You probably are familiar with something very similar to it. And although this is a conceptual framework, I love analogies. So absolutely, I was going to mention this. Even though it's a great analogy, the goal here is really to identify strategy and action that can be taken from an individual perspective, an organizational, a community level, as we move upstream towards primary prevention. So when I say that, I want to review, I keep saying primary preventions, and remember, we're level setting today. So what I want to share next is that model, those three levels of prevention. So this is from, what you see on the screen here is just a screenshot. That screenshot came directly from OCAP's framework of prevention, child abuse, and it is the OCAP's framework, that's right, for prevention. It's the levels of prevention. The document outlines 3 specific, starting with primary prevention. So I'm going to read these to you. Yes, you might be familiar, but again, we just want to level set. So when we're talking about primary prevention, thank you, Jennifer has dropped that into the chat for us. What you're going to see if you click that link in the chat is the full document. Right now we're reading just definitions, but there are also strategies in each column on that sheet. So when we talk about primary prevention, we're talking about activities that are directed at the general population to strengthen communities improve child well-being by focusing on social determinants of health, which we're actually going to review in a little bit. That primary prevention is the bridge, right? Where can you get them before they require secondary prevention? So that secondary prevention is defined as activities offered to populations that have one or more risk factors associated with compromised well-being or child maltreatment, such as poverty, parental substance abuse, young parental age. Here, programs seek to build protective factors and mitigate the risk factors, which we will also be speaking about a little bit later in our conversation. And lastly, what we see on the far right there is the tertiary level. These activities focus on families where child maltreatment has occurred, seeking to mitigate its trauma and reduce the negative consequences of maltreatment, and of course, to prevent reoccurrence. So when we plug this framework back into the analogy, it looks a little bit something like this. Now, as you can see, the primary prevention, that family strengthening, pretty far upstream. We're talking the bridge. That secondary prevention, that targeted risk, is what we call that mid-river. And then tertiary prevention, I'll be honest, in most cases, downstream has like a waterfall. The waterfall's not in this one. But that tertiary prevention is that, that last level, child maltreatment has occurred. So I'm curious to know in the chat, when you look at this graphic and you think about yourself, think about you, the professional that you are, where do you see yourself on this river? Will you tell me in the chat, would you see yourself primary prevention? Are you seeing yourself in secondary prevention? And if you could, maybe tell me what your role or organization is so that we can see what it looks like. So give me an idea of all three. Mike says, Mike, what is your organization or your role, if you will? Tertiary, great. Give us an idea of what organization or what type of role that might be fulfilling, if you would, please. I'm so curious. Prevention caseworkers talking tertiary or secondary, great. I see a primary. I'm so curious to know what you do. All right. Well, child welfare is secondary, tertiary. First 5, primary and secondary. Secondary prevention, great. So I see CASA, tertiary. Kid Start, prevention. Oh, thank you, Mike. Kid Start. So prevention, intervention, yep, treatment. You're right. Cynthia says fixing the bridge at primary prevention, president of CAPSI. Awesome. Secondary and tertiary for probation. Awesome. Actually have a probation example. Thanks for teeing me up on that one. Great. So as you can see in the chat, people might see themselves in different places of this river. So I wanted to, when we're thinking about reimagining, right? We're looking at it maybe from a different lens in a different way. And I heard somebody, I'm seeing so many great responses in the chat, by the way. I see community bridges is primary, secondary, tertiary. Department of Social Services, CWS, secondary, tertiary. Wonderful. So traditionally, agencies' roles may have felt siloed on this river in what their level of prevention is. So an example would be, let's talk about probation. That was actually a wonderful example that came to the chat. Typically, we might only think of probation. What do you think? Is probation an upstream or downstream type of service, would you say, traditionally? I'm curious in the chat, what do you think? We're talking upstream, downstream. Any thoughts on that? Downstream? Great. Traditionally, yep, I'm going to see a lot of downstream, I bet. And traditionally, you're probably right. An example of that, I'm seeing, yeah, great. I'm seeing those downstreams come in. So when we think about probation, we might be thinking way downstream, right? In those tertiary level services. However, during a call early in this series, I want to say it might have been the second, maybe the first or second webinar in the series, we heard from a supervising deputy probation officer who had joined the call from Nevada County in our northern region. His name is Jim Jim Amaral. And he was discussing his county. Oh, someone knows him. Yeah, cool. Wait till you hear what he said. So talking about his county, talking about this shift that typically probation might feel siloed as a tertiary prevention service, way downstream. But he was discussing his work in the county, what the county had been doing to shift that downstream approach, to be thinking upstream, to be moving upstream, and taking that probation. How do you have an upstream mindset? What might that look like? And so this is what he said. He said, probation isn't a term typically associated with prevention in the community. However, with implementation of children's system of care, it's important to understand that probation's job has changed from punitive approach to restorative justice, requiring multiple community partners to swim upstream to minimize the entry of juveniles into the justice system. By swimming upstream, we know that juveniles that enter the river have an unmet need at their home or in the community. So he spoke about this concept of moving upstream and addressing why juveniles are entering the system in the first place. So I think about Jim and probation on the river, throwing out those lifelines, and someone says, what is going on here? Walking upstream a little bit, right? He also stated, the goal is not to treat families in silos, which may have been something that typically might have happened in the past. That's a probation family. That's a child welfare family, kind of siloing them to those systems. Instead, to shift to an approach that this is our family, our county's family, that all county agencies, preventative or otherwise, are asking how they can collectively create systems for not only treating families that are in our system, of course, minimizing reentry, but also to prevent others from getting in the first place. So if Jim was in the room, I'd ask him to stand and we'd all applaud that one. But I thought that was a great example. What does that look like to be what might be considered a downstream service agency field, to be thinking and moving upstream? So I'll have more on that. All right. So that document that Jennifer dropped for you, this is just that second portion of it. And on that OCAP document, what we see are strategies. What are some of the strategies related to those levels? So primary strategies might be reducing poverty and drug use, improving health and access to healthcare, improving school readiness, economic stability. Secondary strategies might include offering parent education programs, providing respite care for families that have children with special needs, increasing access to family-centered substance abuse treatment services. And those tertiary strategies, providing family reunification services, permanency planning, right? Providing parent mentoring programs to families in crisis. And thank you. You can see right now on in the chat, if you click that link, you'll be able to see this portion as well. It's the bottom half of the same document. I show you this because sometimes when we're talking about primary prevention strategy, some of those listed, if I didn't tell you if it was primary, secondary, or tertiary, you might think that, oh, that's a secondary strategy. That's a tertiary strategy. So it's important for people to know that wherever you are along that river, which is a very important role, right? We're all serving that river. You might already be doing some prevention work. So this idea of exploring prevention mindset isn't just how to do it from scratch. Although if you need that, yes, of course, I could give you that too. But I think it's also considering how you might already be doing that. How are you already doing that? Where you might not have considered that before. And then how do we build on that? How do we strengthen that? All right, we're going to move along here. So to reimagine prevention, we need to first explore, like I said, how you might already be doing that. So we're going to start by discussing what a prevention mindset entails, how you might already be doing prevention, and how your work strengthens families through primary prevention. The question of what is a prevention mindset? What we don't have, shouldn't have, is a definition, because it's more of an action, right? What we have instead are some assumptions. These assumptions are, what are the assumptions of having a prevention mindset? What would that look like? What would that mean? And these are, I'm going to say, include, but are not limited to this list, which I'm going to read out together. What is a prevention mindset? It's accepting a collective challenge to reduce child abuse and neglect and to increase child, family, and community well-being. It's enacting change through a shared vision, which is something that you'll see in our upcoming webinars. Lisa asks, will we get a copy of the slide? Lisa, we'll have a PowerPoint dropped in the chat here for you very shortly. It's changing community conditions, building on community strengths, enhancing individual family services and supports. It's centering goals and work in equity. It's making community voice and partnership need to be the driver of change. It's very importantly remembering that everybody has a role. Collaboration is essential, that nobody holds the entire solution. One person isn't serving the river, right? We are all doing this together. Thank you, Dana. Drop the note-taking slides for us in the chat again. Finding upstream prevention, primary prevention solutions by looking beyond those silos, right? Think about that probation example and current funding structures focused on improvement and intervention. And lastly, it's determining definitions of need and measuring the progress using data on disparities and inequities. So these are, we're going to consider this assumptions. These are the assumptions of a prevention mindset. Think of them as the ingredients. That's how I talk about them. These are the ingredients of a prevention mindset, if you will. They are included, but not limited to this list that you see. So the next question is, why do we need it? How is this helpful? What are we doing here? Well, for the type of reimagined upstream approach, right? To see yourself not in a silo, that collaborative approach, all the things that we're talking about with those assumptions, it requires an overhaul in prevention work. It's going to require the breaking down of silos of care, equity-centered and culturally responsive, cross-collaboration systems. And like I said, these are ingredients and these are benefits, of course. The collection of webinars throughout the Reimagining Prevention series, I believe, takes each of these into a little bit more depth, which I really appreciate. They're broken down. As a matter of fact, if you haven't had a chance to see some of the previous, some of those previous recordings that might focus on each one of these individually, I'd highly encourage you to click the link that Dana dropped into the chat, because that is where you'll see the series in its entirety. So how is it beneficial? Well, in other words, why should we be thinking about repairing that bridge for our upstream example? Focusing on primary prevention, focusing on that upstream, that early intervention and support decreases the likelihood of higher level services being needed in the first place. It builds systems focused on child and family well-being throughout counties and throughout our great state. Its access to primary prevention services uplifts us all, leading to healthy, thriving families who receive support before their level of need escalates. It's the question I think Hillary asked in that first one is how can we meet them sooner than we need to meet them, right? So now we've talked about the benefits of focusing on early intervention and support. We're going to look at two frameworks of primary prevention. And this really, it's the goal to strengthen families and improve community well-being. As we look at these two common prevention frameworks, the question that I'm going to challenge you with, and I want you to be thinking about this, is how are you already doing this? I'm asking you that because many of you you're right, you're really in those tertiary, secondary services. Yep, agreed. How might you already be doing prevention work? What can we build on? What might you already be doing that you don't think of as primary prevention, but it is? And then how do we strengthen that? So I'm going to challenge you to think about that as we explore this together. Now, we're going to do a very high-level overview of the protective factors and the social determinants of health. Before I do, I want to acknowledge, I've seen who's registered for this webinar. I'm very excited and grateful that for some of you, this might be an absolute refresher, right? But it's really intended to be a high-level, quick-touch overview. And you might be more familiar with some than others, but again, this is a foundational level set. So that's what we're going to do here today. But before we get started, I'm going to do a quick activity. It's one of my favorites. It comes from the Children's Trust Fund Alliance. And I'm going to show you an image. And then I'm going to ask you a question about that image, okay? So get ready to type in the chat. The question is, when you see this photo, what risk factors do you see? Anything? We'll say maybe one. Anything come to mind? You could drop that right into the chat. Smoking. Absolutely. What else? What other risk factors might you see? Litter box is accessible to children. The medicines left out. The knives are out. Electrical outlets. Mom's tuned out. There's a knife on the counter. There's scissors on that counter. Trip hazards, electrical cords. Absolutely. I'm sure that there are pot handles, liquids on floor. Parenting style, safety concerns. Absolutely. I ask that because I feel like when I show this image, especially to a profession, a group of professionals as well versed and skilled as you are, it's like, where's Waldo, right? Just boom, 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 boom. It's really, people's eyes start going to that knife right away and that cigarette right away. Those are always the two first that people see. There's food on the floor, there's medication. So we're looking at the risks, and you're correct. And you are correct. So here's another question. It's a different question. I'm going to ask you to reimagine this picture with this new question. And I'm going to ask you, if you answered in the chat this time, please do it again. As you look at this picture one more time, what might be some strengths that you see of this family? What is this family doing right? Both the parents appear to be smiling, or caregivers. There's notes on the refrigerator, little artwork. There's food on the counter. There's fishing poles. So maybe they're recreational. There's electricity because they're watching TV. There's toys, housing. Someone said it looks like kiddo is really excited to see that caregiver. They're in a home. There's shelter. Absolutely. The child is dressed appropriately. They've got socks on. Wonderful. There's a basket of laundry. There's clothing in the house. Laundry. Wonderful. Dad is carrying groceries. They have a cat. That's a strength. Toys. Great. Perfect. I'm very grateful for all of your answers to that. So books. Thank you, someone, for seeing that. So here is my question. I'm not asking you to be honest about it. You can just send it to the host if you don't want to answer publicly. When you saw that picture, the first and the second time when you reimagined it, what was easier for you to spot? Was it when you looked, was it faster to see the risks, or was it faster to see the strengths? There's no right or wrong answer to that. The strengths, great. Strengths, wonderful. Strengths, hey, this is great. Smiles, cool. Perfect. Well, look at all, okay, well, then that's the presentation. Bye, folks. Just kidding. I'm really grateful that you say strengths, and I'll tell you why. Typically, as I go through this training, because it is part of a protective factors training through the Children's Trust Fund Alliance, I am a certified trainer through that as well. And it is very easy for helping professionals, especially professionals that are doing home visits or they're working in those tertiary levels, that when they see this image, maybe instinctively, they see that knife on the counter and they see that there's not very much food in that pantry, or they see the pot handles are in the wrong spot. They see that there are electrical cords exposed. They see that medicine on the counter. They see the scissors. That's not a wrong answer. But the protective factors framework, which is where this activity comes from, asks you to look at the strengths of the family. The risks, I understand, are important. So are the strengths. And the protective factors framework is a strengths-based approach. It requires it. It needs you to look for the strengths in a family to build upon. And some of the good things that you mentioned in here, like we talked about, the child is excited to see the caregiver. It looks like there's recreational fishing poles. They have an animal in the house. All of these different factors that we found, these characteristics of this family, are actually Some of them are the same characteristics of those protective factors. So thank you for doing this activity with me. I'm going to now talk about those protective factors, and I think we're going to build upon this, this photo that we saw. As I do that, actually, before I show you the protective factors, I have a little question. The question is going to be a poll question. When it comes to the protective factors, this is anonymous, by the way. How familiar are you? How familiar are you? Very familiar, like you could host a protective factors course. Familiar, like you know the names of them and you have an idea what they do. Somewhat like, yep, I've heard of them, Jess. Maybe we should run through those one more time. Not familiar is, I'm really happy we're covering this today, and I'm about to go grab my PDF notes right now. I'm going to actually read out a comment in the chat, which I think is very important. I love this exercise because not only does it align with what a group of professionals might be looking for, the hazards and the risks, but it's mindful practice for folks with trauma. Walk into a space, look for the risks. But we train ourselves to, instead of only seeing the possible threats, be aware of the whole space. Absolutely. Thank you very much for noticing that. Okay, so I have 57% participation. I'm going to let you off the hook on this one, but I'm going to end the poll and I want to show you where we're at. So it looks like the majority in the House are really in between that familiar and somewhat familiar. And by that, I mean, you've probably heard the term protective factors. You've probably heard it mentioned in the in the Reimagining webinar series. You may have seen it, heard about it once, but you need a refresher. And I am so thankful for that because I will be going through each one, kind of a brief overview, but there are so many incredible free resources to you and your staff. And as you're considering this reimagine prevention, you're going to need this protective factor information. And I am so thankful that it's available to you, and I'll make sure to tell you where to get it. So, and thank you for your honesty and for sharing as well. All right, moving on here. So these protective factors, there's 5. The Center for Study of Social Policy, CSSP, developed the strengths-based protective factor framework. The goal was to create a systematic approach to prevention that would reach large numbers of children long before abuse or neglect occurred. This is a primary prevention strategy. The protective factors framework was designed to assist professionals like you who work with children and families in promoting the optimal development of all children while protecting vulnerable children from maltreatment. As I provide a brief overview of each protective factor, I am going to challenge you to answer a very important question. How are you already doing it? How are you already folding these protective factors into your work as an individual provider, as an organization, as a system? Because you might not think you are upon first glance, but I'm going to challenge that. And if you're truly not, then great, because this is where you're going to get the information and we're going to build upon it to see what could it look like. And also, who are you partnering with? Remember, it's not just your river. There are many providers that have come to assist. So who are your partners in these protective factors? Also an important question that we're going to be addressing. Also, Dana has graciously dropped the CSSP Strengthening Families work. It wouldn't be the workbook. This is the main link to learn about it, but I will also be sharing where you could get more information about it as far as training goes. Our first protective factor is called parental resilience. That palm tree is not an accident. That palm tree is to provide an idea of what parental resilience looks like. The official definition is the ability to recover from difficult life experiences and often to be strengthened by and even transformed by those experiences. Very much like the palm trees in this photo, they will bend, they will not break. So resilience, simply defined, means the ability to recover from difficult life experiences and often to be strengthened by and even transformed by those experiences. Resilient parents have empathy for themselves and others and are able to keep a positive attitude, to solve problems creatively, and to take life's events in stride. They're able to bounce back, if you will, from negative experiences. So resilience isn't about how many bad things you experience. Resilience isn't about how many bad things you experience. It's about how you respond to them. What do they say? You can't avoid stress. You can only manage it, right? So very simply put, more resilient parents are stronger parents. Parents who are more resilient will be able to take care of their children even when they're experiencing their own crisis. So from a prevention mindset perspective, if we think about that, if we think about what is the benefit to ensuring that parents have access to tools, resources, information, services that build parental resilience. From a prevention mindset perspective, strategies that providers might utilize are building parental resilience and also reducing or minimizing, we should say, child abuse and neglect. It's important to have this parental resilience. So how could you help? What might that look like from you in your seat? It might be responding to family crisis by making referrals for a family. We know that parent is in a crisis. What's the referral? What's that next step? It might be valuing and supporting parents, ensuring that they feel welcome and involved in the decision-making process at all levels. When they do need that help, when they come to you because they're in crisis, how do they feel welcomed, encouraged, supported, and involved really in the next step of what happens? So, I love Amy's response. I love this. I think so many people don't realize their own power within resilience. Absolutely. So let's think about you as a provider. I've heard we have them all. We have FRCs, we have probation, we have child welfare, we have all these wonderful family supportive services on the line with us. So when you think about parental resilience, how are you already doing this? How do you think you're already doing this in your agency? What might that be looking like? How might you be, let's say, responding to family crisis or making sure that parents feel welcomed, involved in that decision-making process? Any thoughts? You could type it right into the chat, sorry. Building resilience is so important in children and parents, absolutely. So the question is, how are we doing it? We defer to parents on their input on situations. That's wonderful, Stacy. So by deferring to parents, you've kind of made them that subject matter expert. Diversity, equity, and bias testing training, amazing. That's great. Validating, listening without judgment, and being my authentic self with them. That's wonderful. That's great. Some others I might have seen through the many protective factor trainings that we've done through CalTrin. Supporting parents as decision makers. I see mindfulness skills. Absolutely. Encouraging parents to manage stress effectively. Listen, there's a lot of ways to manage stress. Am I right? We want to focus on the healthy ways to do it. That may not be intuitive. Let's see. I complete protective factor surveys with parents to help them see their strengths through their answers. Amazing. As a CASA, I try to meet the parents and resource parents from a place of empathy and asking how I can help. Mostly try to provide hope. That's wonderful. You're there as a support as they are making important decisions about themselves and their family, right? Wonderful. So I might also hear people say, I saw in there the mindfulness skills, thank you, which is helping parents learn how to manage stress effectively, helping parents understand how to buffer their children during stressful times, right? As caregivers are figuring out how we buffer those kiddos. Is that an option? Is that when we think about upstream, yes, your service may be further downstream traditionally. How might these be folded in, right? These protective factors give us those ideas of how we might be able to do that. All right, I'm going to move on to the next one. That next protective factor is social connectives, social connections. Why is social connections a protective factor? The ability and opportunity to develop positive relationships that lessen stress and isolation and help build a supportive network. In other words, Stacy said it, so people don't feel isolated, right? Parents need parent friends. Totally get that. So Why is this a protective factor? We find that answer on the website for Child Welfare Information Gateway, which says parents with a social network of emotionally supportive friends, families, neighbors often find that it's easier to care for their children and themselves. Most people need people they can call on once in a while when they need a little sympathetic listener, right? They need some sympathy, they need some empathy, advice, concrete support. Research has shown that parents who are isolated with few social connections are at higher risk of child abuse and neglect. Some strategies that we can take to help build on those social connections, this particular protective factor might be facilitating friendships and mutual support for these families as an organization, as an individual, as a system, helping parents connect with each other and developing social networks. So at CalTrin, I've heard many stories of different service providers creating that parent-to-parent support group, workshop, watering hole, right, where everybody gathers. And let me tell you, because it is a collaborative effort, there are many providers. The first that come to mind are the family resource centers. Great people to know in your community, wonderful, required to be at the table during this process, right, of figuring out what is available and how do we strengthen this protective factor. So I'm going to ask you now to think about that. In the chat, what type of social connections are you already creating for parents? Or if you're and what agencies might you partner with if it's not within really your agency scope? What do you think? You could drop that right into the chat. How are you supporting social connections already for parents? And who are you partnering with? Starting a teen parent group support. Wonderful. Support group for dads. Amazing. That's great. Now, let's say mommy and daddy meet groups. Wonderful. So here's the thing. It's also about who you know in your community, who you can make referrals to. If you don't have a parent, let's say, group, what does that look like? That moving upstream is asking, where are the other partners? Who can I collaborate with to make sure that those referrals, it's not just a, probation family, child welfare family. It's a community family. What community resources are available? FRC is providing parent cafe sessions. I've seen it done virtually, in person, a lot of options. Wonderful. It's important to have a lot of different ways that parents can connect. Absolutely. We work with a local group. That's great. Wonderful. Support and engage families. Wonderful. Great. So this is a question, free events. That's great. What's this parent cafe? Linda asks. Sakaro. We can probably get you some information as well through CalTrin, but these are great questions to be asking. What is this parent cafe that you speak of? Okay, let's move right along. The next is the knowledge of child development. So parents who have some knowledge of basic child development are more likely to have realistic expectations of their children. With that knowledge, parents are better able to provide an appropriate amount of nurturing, supervision, guidance. When parents understand their roles in their children's lives and learn about specific parenting techniques and strategies, they can form positive relationships with their children and have options for appropriate responses to typical child behaviors. And by the way, there's a parent cafe link in the chat. Dana, thank you so much for that. Some ways that we can serve our families include creating fact sheets about child development stages, providing guidance, modeling developmentally appropriate interactions with kiddos. I used to be a first five care coordinator. So I just think about first five or those type of, services that offer those workshops, those referrals in and out, what that could look like. So my question for you is the same as it's been before. How might you already be supporting parents in this way? How might you already be supporting their knowledge and encouraging and growing of child development? Or who are you partnering with? Are you partnering with anybody? You can put that in the chat. How are you promoting those factors? I'll give you a second while you type it in. And remember, we know that parents are better able to provide that appropriate amount of nurturing, supervision, guidance when they know. We partner with public health nurses, wonderful, parenting classes, Free parenting classes, wonderful. That's great. Home visiting, ASQs, that's great. First 5 developmental wheels along with parent workshops, that's great. ASQs, strengthening families. And so if you are a provider of that information, you are a provider, those are your workshops that you're doing, right? That idea of the upstream approach is that we're all meeting together to be thinking through what that looks like. So a family has access as early as possible to these wonderful services provided. Okay. I believe this is our fourth protective factor is concrete support in times of need. Access to supports and services that reduce stress and help to make families stronger. It's about that strengthening family, right? Every family at some point needs help. It could be a minor challenge. It might be a big critical situation that is essential to the family's survival, no matter the level of need. Help from relatives, help from friends, organizations, churches, variety of other sources are sometimes the lifeline for that family in need. So if we help families find the access to these essential sources of help, we will be building protective factors against stress and in turn against possible child maltreatment. I think too about the conversation of concrete support in times of need. And sometimes those needs, like they said, they can be emotional needs, but sometimes they are tangible, basic needs. It's getting families those basic resources. And I think about the literature that we've actually in your pre-work to this webinar, and it will be on the Reimagining Prevention CalTrin website as well. We provided it was like an article. I actually have a printout with me. It was talking about child welfare and disproportionality. It talked about poverty, the rates of families who are introduced to the system because of needs that are very closely related to poverty. That neglect isn't always intentional. It's something that Protective Factors has talked about quite a bit that I appreciate. And I feel like concrete support in times of need is sometimes that lifeline to that resource that they need, right? So when we think about how can we help these families find and access these essential sources of help from any seat, from any place along that river, we might do that by linking families to services and opportunities, responding when families are in crisis, helping families to develop skills and tools that they need to identify their needs and to connect to supports, to connect to much needed support. So I'm wondering, with your role, we'll do this one more time. How are you linking families? Are you providing resources, referrals? Are they typically basic needs? Are we doing community partnerships? What does that look like? I'm so curious in the chat. Differential response program, providing one-on-one support and referrals to community services. Awesome. It's about knowing who to refer to, having those players at the table, right? That's wonderful. Lots of follow-up and connecting with the family. Wonderful. If I cannot assist, we refer out. Wonderful. That's great. It's like that old customer service model. The worst thing you could do is nothing at all, right? Providing resources and referrals, but also trying to lessen the stigma to ask for help. Amy? Absolutely. And part of that strengthening families model is when parents come to you, when these caregivers do have a concrete support, do have a need, and especially if they ask for it, it's encouraging that. It's encouraging that as a strength in the family. Remember, we're talking about seeing through that lens. You think about that black and white photo of the knives, but also the books. How can we highlight the things that families are doing well? That's the idea of the protective factors. And our very last protective factor before we move into social determinants of health. This is social and emotional competence of children. So family and child interactions that help children develop the ability to communicate clearly, recognize and regulate their emotions, and establish and maintain relationships. This is an interesting one. This is the only protective factor of the 5 This is the one that addresses specifically issues with the kiddo. The others are parent-facing, they're more parent-driven. This protective factor addresses the importance of helping children become more capable of handling those life challenges socially and emotionally as they grow and develop. So children's social and emotional competence is seen in their ability to communicate clearly, to recognize and regulate their emotions, to establish and maintain relationships with others, and engage in problem solving and conflict resolution. So these competencies emerge gradually as a natural developmental process, but children who have these skills are likely to grow up to have healthier behaviors, better peer relationships, higher capacity to respond to stress. Helping children to develop these skills can also improve family relationships and prevent abuse and neglect. And think of it, why? Why and how would a kiddo who is able to, who is receiving that skill building on healthy behaviors, managing stress, higher capacity to respond to stress, how does that improve family relationships and prevent abuse and neglect? If you were in the room, I would call on somebody. So you've been very participatory. Thank you. I'll make this one a rhetorical question. When parent-child relationships are mutually rewarding, there's a greater enjoyment, increased responsiveness, and decreased likelihood of maltreatment. So some ways that we can help and we can assist here is helping parents and supporting caregivers foster their child's social emotional development. Model nurturing, help children develop a positive cultural identity and interact in a diverse society. And these are just some things that we could do to name a few. And I look at that image on the screen of that like happy face and sad face. Part of the protective factors, there's a wonderful exercise in the protective factors free training available that says, how are parents teaching emotional vocabulary? So we think about developmental stages, vocabulary. How are we teaching emotional vocabulary to kiddos? I feel, I am, I am fill in the blank. I love those images on the screen. What you see is, how are you feeling? Having them identify emotions and manage. I digress. But this protective factor is a little different, so I wanted to push into it a little bit. So the question is, and this one is actually probably one of the more difficult ones to think about, especially when I'm doing trainings, but how might you already be doing this? And if you've thought to yourself, that's a great question, Jess, how do we do that? Or how could we do that? What could that look like? You're not alone. This one is the toughie, but there are strategies, and these strategies are built into the protective factors framework, which is why we're talking about it today and why I want to make sure that you are familiar. Okay, I'm actually going to keep moving for sake of time here. Oh, look, I see modeling role playing. That's wonderful. I remember speaking to a first five in the Mountain Valley, I believe. And they were talking about hosting courses, classes that were going to help in these areas, right? These evidence-based frameworks, talking about protective factors, making sure that families had easy access, not just families that needed it, but the families that didn't need it yet, right? That moving upstream model. Interactive parenting trainings, parents as teachers program, wonderful. Naming emotions with a question, that's wonderful, great. All right, I see help parents access preschool and children's social groups. Way to go, family events, absolutely. Okay, so if we've been, having this conversation and you're thinking to yourself, you know what? You've asked me, how am I already doing this? And I'm not sure, Jess. I'm still trying to think upstream here and I want to build on what we're already doing, but I don't know. I'm going to challenge you to, this is not in one of your slide. I'm sorry for the game day decision. I'll make sure you get a copy. Look at these primary prevention strategies. These are just reframed ways of looking at your protective factors. Responding to family crisis, valuing and supporting parents, facilitating friendships, strengthening parenting, linking families to services or maybe opportunities, observing and responding to early warning signs of child abuse or neglect, facilitating children's social and emotional development. If you've done any of those things, you're doing primary prevention. You didn't even know it. Isn't that exciting? What could you do with just that extra partnership, that extra information, that intentional upstreaming, if you will? What could it be? That's that reimagining, right? Reimagining prevention. Also what we see in the chat, thank you so much for dropping that, Jennifer. It is a CalTrin CBC webinar that's coming up on well-supported in-home parent skill-based programs. So if you're looking for that evidence-based information, that strategy, that skill set, I'd highly encourage you to join. Your facilitator is amazing. She's actually the one that dropped the link, Jennifer. All right. So next, I'm going to, again, high-level overview. We're going to talk about social determinants of health. And I want to make a distinction. I'll make it one more time at the end. These two frameworks, I find that sometimes people are either using one or the other. They don't think about them as an overlapping or something you could do concurrently. Not too sure what the similarities or the differences are. There are 5 of each, which can be confusing. Everything that we've talked about so far, these protective factors, they're very family-based, right? We're talking about parents, home, one-on-one, direct services, or group services. It's very family-driven, very family-focused. Social determinants of health, we're talking more systems level. And when I say systems, I have to tell you my personal hesitation. My concern when I say systems is that sometimes think that system means someone else. System is someone else's thing, right? We don't see ourselves in the system, or we don't see how we impact the system. So bear with me as we go through this and know that you make up these pieces, right? And for a lot of you, depending on the service, the field, the service, the way that you are connecting and serving these families, you intersect with these somewhere. So let's talk about them a little bit, and then we'll make sure to, already in the chat, what we have is an incredible resource for you through the CDC. We are the system. There you go. I like it. That's going to be the bumper sticker. We're going to need you to make that, please. So what we're going to cover is very high level, like I said. And as a matter of fact, the link that you click on will give you some strategies, thoughts about it. Yeah, let's just keep going. So the first one I want to talk about is healthcare. Well, let me first define it. So before we speak about social determinants of health, and when I say it, I'm curious, how familiar are you with it? Just like we do with protective factors, this is anonymous, and it's the same scale. Very familiar, like, yep, I could talk about this all day. Don't sit next to me on an airplane because we're going to talk about social determinants of health. Or are you kind of familiar, like you've heard the term, somewhat, like, let's talk about this. Not familiar is social determinants of what was that, right? So, and it's okay. All answers are welcomed. We have 100% participation, and I appreciate that. Let's see. So I'm going to end this poll, or almost 100. Okay. A little different, right? So here, the very familiar, we didn't have too many that were very familiar in the last. We are kind of sliding down a little bit. So we have familiar, we're mostly somewhat familiar, like a refresher would be helpful, which is good to know. So good to know. Remember, we're touching high level here, but there's so many great resources that we can point you to. And then the not familiar. Okay, so I love doing my part. That's what we can all do, right? We all do our part. That's what moves us forward. Okay, so we all do our part, but we also know that we can't do it alone. We do it together. We do our individual part, we do it together. So the conditions in which you live, learn, work, and your age affect your health. Social determinants are non-medical factors that influence your lifelong health and general well-being. They have an important influence on health inequities. So when we think about social determinants of health, we can start to see, there's so much great information about actually in the link, the CDC link, about how do inequities start to play? How do those get folded into the conversation of social determinants of health, especially those that might be lower in socioeconomic families. I mean, there's a lot of factors that go into it, but let's talk about what each one is in a little bit of detail. So let's start with the healthcare access and quality. What is it? This is the connection between people's access to and the understanding of health services and their own health. This domain includes key issues such as access to healthcare, access to primary care, health insurance coverage, and health literacy. Health literacy. The next is education access and quality. So the connection here is between education the connection between education and health and well-being. This domain includes key issues such as graduating from high school, enrolling in higher education, educational attainment in general, language, literacy, early childhood education, and development. So far, we've only touched on 2. But if you think about the large umbrella in which it covers, so what those domains cover, how impactful that can be on the experience and life of an individual, a family, a community, when we're thinking about these factors and the varying degrees and levels of them. The next we'll talk about is social and community context. This is the connection between characteristics of the context within which people live, learn, work, play, and their health and well-being. This includes topics like cohesion within a community, civic participation, discrimination, conditions in the workplace, and incarceration. Next, we have economic stability, the connection between the financial resources people have, so that would be income, cost of living, but also we're talking about poverty-informed care here, employment, food security, housing, stability, and lastly, we have neighborhood and built environment, the connection between where a person lives, where did they grow up, what is available to them, what's the housing like, what's the neighborhood, what's the environment, and their health and well-being. This includes topics like quality of housing, access to transportation, availability of healthy foods, air and water quality, and neighborhood crime and violence. I think about some of the models or some of the, if you go on the CDC website and there's so many others, they'll give examples and they typically give it in a context of imagine 2 twins born in 2 neighborhoods in 2 different areas, right? Similar to that Upstream model, I feel like they use that one quite a bit. 2 people, if given the opportunity to live in 2 different neighborhoods or have access to 2 different types of education, different levels of economic stability, what the outcomes might look like. How will that affect long-term health and well-being, thriving, nourishment? So when we think about the social determinants of health, it feels so big, right? It can feel so big because it's like the system. But like we said, we are the system. So what are some strategies here? What are some approaches? What could that look like? And remember, this is very high-level overview. We're not diving too deep into it, but we will absolutely make sure that you have the resources for it. Here's a screenshot. So let's talk about preventing child abuse and neglect. And I pulled a specific example for you. What does support look like from an organizational, a system level, if you will? This slide illustrates some strategies and approaches. For example, let's take on the left column, we're going to go 4th one down. Enhancing parenting skills to promote healthy child development. Some approaches might be early child home visitation, parenting skills. Let's talk about strengthening economic supports to families. That could be strengthening household financial security, family-friendly work policies. I mean, it gets really big really fast. And the question is always, when you think about your role, when you think about your organization, the system in which you work, are there any of these specific social determinants of health where you might see that you're kind of already involved, right? You didn't say, I want to be in this social determinant of health area. You just kind of are my proxy. Any thoughts on that in the chat? If you would give me the organization or the type of role that you fill or your organization does, and what area of this, if any, do you see yourself impacting? What do you think? I'm so curious about this one. This one's going to take a little extra. I will take a quick coffee break while you think about that. Any thoughts? Which of these determinants would you say you provide the most, maybe even support or guidance within your agency to families? Social and community context, wonderful. I'm so curious what type of agency or role you do. What else? Let's think about it. Any assistance with housing, healthcare access, social and community context now as outreach specialist, wonderful. Healthcare and access, cool. Healthcare access, yeah. It's always an interesting one, right? Some food for thought. So let's social and community context, wonderful. Now let's not forget that when we talk about primary prevention per the OCAP framework, they talk about these social determinants of health. I mean, you can't start moving upstream without seeing yourself as an individual contributor, organizational contributor, systems contributor to both of these frameworks or using these frameworks, the social determinants of health and the protective factors. So let's talk about what they, just as a quick recap, how they're kind of different from each other. They both have 5 areas. That can be the confusing part, but also helpful, I guess. The protective factors is family focused. I know that's a quick overview. And I know that there's so much great information out there, but this is a level set. Want to make sure that you have the information. And if there's a particular area where you would love more guidance and resources, I'd encourage you to put that in the survey. Protective factors are family focused, right? We talked about how to specifically work and strategize with families. What does that look like as a provider? Whereas the social determinants of health are more systems focused. All right, I don't want to run out of time. We've had such a great time together here. So I guess a question to think about is, where do we start? So we have this graphic and now I'm downstream. I want to go upstream. I want to be more prevention mindset focused. What does that look like? It really starts, someone said it kind of starts with you. It starts with the individual mindset. It starts with even that family activity that we did. What lens are you seeing your family through? How can we see a family in a strengths-based approach? And how can we start partnering and moving upstream to help mitigate some of these factors from happening in the first place? How can we have access and not wait until they're downstream is what I'm saying. So I have a couple of thoughts to share with you. These will also be in what you receive. From an individual perspective, you in your office, individual care provider, whether you're at a family resource center, maybe you're doing probation, child welfare, it's knowledge, understanding, or thoughts about primary prevention. And when I say that, I mean protective factors, social determinants of health, the knowledge, the understanding. When I say thoughts, I mean, what are your personal thoughts about it, right? Do you see how it's helpful? The way that you see the lens changes the way you see the world, right? And it's also reframing. I used to think this, but now I'm wondering if that. And as we go through these different conversations and we're looking at these frameworks, I'm asking you to think that way. What are some things that you might have thought before about your role on that river? And what do you think now? So if you, when I asked, where do you see yourself? And you said, I'm tertiary secondary, I'm all 3. If that has shifted even a little bit for you upstream, I hope it did not shift you downstream. If it shifted you upstream a little bit, I'd love it if you shared that in the chat. So maybe I thought I was tertiary. Now I'm realizing I can kind of do all 3. Or after reviewing these primary prevention, I'm realizing I actually have been doing some primary prevention work. If you would share that in the chat, I would be so grateful. Next, we have organizational mindset. What does that look like? What does that mean? And I'm actually going to talk about that in another slide. But it's building a shared vision around prevention mindset. Sounds like a big task, but there are so many resources to help. And a lot of the webinars that we've talked about that have either happened or are coming up build upon that. As a matter of fact, the next session is about change, more change, the J curve of change, the process of change, what to expect as a leader as things are shifting. How do you encourage your team, prepare them, support them in this important change? And we know that change can sometimes feel uncomfortable, right? It's professional staff training and development. So if you are a leader on this call and you're asking yourself, has my staff done a protective factors training recently? Have we talked about social determinants of health? Have we talked about how these are absolutely vital to the families that we serve? I'd encourage you to really reflect on that and to think about that and to know that there's many free trainings and resources, many of which are provided through CalTrin. I can tell you some about them at the end of this webinar about protective factors, making sure that people, is it included as part of an onboarding process? You hire new people, are they hearing about it regardless of where you're working, what type of agency, tertiary, secondary, primary, wherever you are. And also the retraining. Who knows if you see the protective factors again a couple months from now, what you might gain from it that time. So what does that look like? And lastly, we talk about it from a community level, the upstream support from prevention planning teams, getting familiar with the CAPCs in your area. So we're talking about upstream and bringing the people together, right? The partners, the providers, the folks that have to sit around the table together. Where are they already? So it's important for you to know these type of things. Who's your prevention planning team? Who is the CAPC in your area? All right. I told you I had this example of an organizational prevention mindset. Here is a snapshot. What are some examples of a prevention mindset within an organization? What might they be looking at? Does this look vaguely familiar to you? You're like, wait. This feels a little familiar. Maybe it feels a little bit like the protective factors. That is not an accident. That was intentional. An organization focused on prevention mindset would be looking at these type of pillar areas, whether it's training, mindset, strategy. Together, these outcomes strengthen families, strengthen providers, strengthen communities, reduce the likelihood of child abuse and neglect. They're services and systems that are centered in equity. These are three very important things as we're moving towards prevention mindset. So we think about equity, diversity, equity, inclusion, poverty-informed care, folding in, highlighting, raising up lived experience, lived expertise, if you will, cultural humility, trauma-informed organizations, under resilience. By resilience, we mean how are you building kind of that fortitude, that resilience of a provider, of you and your staff, whether that's change management series like we're doing now, compassion fatigue and learning about secondary traumatic stress, those resources, those training, workforce development, which we know impacts retention, community involvement, which is collaboration. We talk about knowledge, so that onboarding of staff and training. How are we folding in the knowledge of protective factors, primary prevention, data and evaluation, which we do have a webinar coming up shortly about that. And lastly, funding. How do we get funding? FFPSA webinars, technical assistance, strategic planning. These are all very important questions that you might have, especially the funding questions. And I can tell you where to go. I believe it's in the next slide. And then we are going to end, I think, right on time. So what are some next steps for you? What are some thoughts here? What could they be? Well, what do you already know? What do you already know about primary prevention? How much of this was a refresh? How much of this was a, I need to dig a little deeper into this. Where do you go to learn more? CSSP, that's, we talked about that earlier with the protective factors. We'll make sure to drop all of these links in your follow-up email. So don't worry about scrambling to write everything down right now. The Children's Trust Fund Alliance, who does these free, self-paced, accessible protective factors training. CDC, also, we've dropped some resources there today. CalTrin, we are so grateful to serve you, to serve the helping professionals that are working with families in the state of California. We offer quite a few training and events that are free, no cost to you, thankfully funded through OCAP. And I just have to say that some of you in the chat, I know from those trainings, and it's so great to see you. How do we move towards that primary prevention mindset? It's assessing where you are right now. You have to know where you're at now to know where you need to go next. It's the community engagement toolkit. It's capacity building assessments, right? These are those things that you might have heard about in the Reimagining Prevention webinar, but we're not diving into today. Who is your local prevention planning team? Who is that CAPC in your area? And thank you, Jennifer. CAPC is the Child Abuse Prevention Councils. And then, of course, if you have very specific questions to FFPSA, we do want to remind you that there is an incredible catch-all email, the FFPSA Prevention Services email inbox. Great place to send your general questions. I know that there's a Q&A coming very soon, thanks to the questions that you've provided. All right, very shortly, I also want to remind you that there are some upcoming webinars that are continuing on this Reimagining series. I will say that's all the content I have for you today. I was so grateful to be here with you. So thankful for your time and your attention and your participation. There are some great upcoming, oh no. Look at that. I got so excited to tell you where to go next. So the upcoming webinars are focused in different areas. They even have the CAP month webinar series, which is great. Redesigning child welfare around prevention, equity, and well-being. Right on par with what we've been talking about today. We're going to be talking about well-supported, evidence-based, wonderful programs. That is something that's also been dropped into the chat. We have 2 more trainings in this particular series if you'd like to continue this journey with us, which is leading through change and cultivating commitment. So now that we have an idea of this prevention mindset, how do we start directing, have an idea of where we want to go as an organization, change through the process, knowing that change is not everybody, it doesn't happen overnight. It does take some work. And what are some things that you could do to prepare and encourage that process? And then how do you build and cultivate commitment around that prevention mindset? So all of these things and more are upcoming webinars. There will be also a great Q&A session that's happening very shortly. And it's Thursday, as a matter of fact, about the comprehensive prevention planning. So if you were hoping I was going to answer some questions about that, I'm not. But on Thursday, we'll have quite a few answers for you. Highly encourage you to sign up and join. And with that, the very last slide of the day is a few reminders. We're going to drop a survey. Please, if you will, fill out the survey. Let us know what is the most helpful and what could be more helpful, right? This is our dialogue. You ask your parents, how can I best support you? I'm asking you. So I highly encourage you to do that survey. The webinar materials are available in a follow-up email in the next 3 days. And then don't forget to register for the next upcoming events, to include the next change management event happening called Leading Through Change. And with that, I want to say thank you for your time. So excited to spend the morning with you today. I'm happy to hang out for a little bit. I'll stop the recording now, but I will hang out in a while in the chat should anybody have any questions. And Dana has dropped the survey link. And thank you.